Assemblyman Weber.
Thank you, Mr. Speaker. On the bill?
On the bill.
Mr. Speaker, I want to congratulate the sponsor of the bill for having exactly the right intentions and the right goals to expand health insurance and access to health insurance in New Jersey for our children. However, I disagree with the way in which we're going about it. We just have different philosophies on how to get to the same goal, which is more accessible, more affordable health insurance. The Family Care Program, as I've researched it, is a program that is, even this year, rife with waste, fraud, and abuse. I have a news clip here that was dated from April, Mr. Speaker, regarding an audit of the Family Care Program. And some of the items that the auditor found were that people earning as much as $295,000 per year were enrolled in New Jersey Family Care. And this program was supposed to be for the working poor. The auditor found that there were no attempts to collect $4.6 million owed to the state by over 16,000 people who were once enrolled in the program. The auditor found that there were $2.1 million in payments over a 2-year period for medical equipment that should have been paid for by nursing facilities. The auditor also found that they were improperly calculating Medicaid reimbursements for some equipment, and in one case, the state reimbursed someone $8,000 for a wheelchair that should have cost $5,000. And the auditor also found that spending $100,000 by the program was spending $100,000 by sending as many as 3 blood pressure monitors to Medicaid patients, even though many come with warranties and are replaced for free by many drugstore chains. Those are just some of the examples of a program that I think is broken, frankly. And as we saw with the school construction bill earlier today, it seems that all too often in our body the response when a program appears to be broken is to expand it. And I think we should be going in the opposite direction. When a program demonstrates that it's broken, we need to pull back, fix it, and then go forward. Another problem I have with the bill, Mr. Speaker, is that the costs for this program are very unclear. It's unclear to me in our bill comments. It's unclear to me still exactly how much we'll be spending in the next year. There's some estimates that it's $9 million, some estimates that it'd be $21 million. I've seen other estimates by the sponsor, I think, on the Senate side, that it could get into the $120 million range over 1 or 2 years. And I think that before we vote on something, especially in these tight budgetary times, that we should know exactly how much it's going to cost before we vote to expand a program. But the real problem that I want to address, Mr. Speaker, is that this bill seeks to cure an ill that the government itself has caused. The definition of insanity, it's been said, is to continue to do the same thing and expect different results. And the reason we have so many uninsured in New Jersey and so many uninsured children in New Jersey is that we have overregulated the health insurance market in our state. And the cure, to me, is not to increase government control over our health insurance market. In fact, the cure would be to go in a different direction. Our rules and regulations have priced families out of our health insurance market, and now our response to that is that we're going to tax us more, to spend more, to subsidize those families, to pay for insurance policies that we've made too expensive for them to buy in the first place. Only one other state in the Union has a universal mandate for children, that's Massachusetts, and I think we've read a lot about the problems that Massachusetts is experiencing with their health insurance universal mandate. As we know, this is the tip of the iceberg. A full universal health care mandate is coming down the pike next year, I believe. And I suspect that the same sponsors will be sponsoring similar legislation, and we'll be having the same debate next year on a grander scale. There are good things about this bill. It addresses problems with community rating. I congratulate the sponsor for recognizing that when young people have a greater incentive to buy health insurance, that they'll buy into pools. And the reform with respect to community rating is a positive one, I think. But on the whole, the government should be providing a safety net when it comes to health care in our state, not a net that ensnares families in New Jersey with overregulation and too many rules and too much interference in their health care choices. If we are truly concerned with affordable and accessible health care in New Jersey, Mr. Speaker, I think we will first reinvigorate our health care market with more choices in the private sector for our families. And so I will oppose the bill. Thank you, Mr. Speaker.
Assemblyman, thank you.